Hey, it's Dr. Bill Williams in Atlanta, Georgia, and I'm talking about why a dentist would be interested in ASEA and the, the science of redox biochemistry. And the topic today is how, as a dentist, I grow my practice. What are the factors involved, and what am I looking to do in terms of adding ASEA redox as part of my clinical regimen? So let's get a little background here. One of the most important things, and I teach dentists as part of what I do, I have an ongoing mastermind for dentists, and I do video conferences and involved in teaching dentists for the last 35 years. And I share with dentists enough about what I do that's making us successful. And I try to teach them to be able to finish well through systematic planning and to strategize with the end in mind. So I'm always looking for giving dentists who are clients of mine an edge over the competition, an edge over being an average ordinary dentist. I want to help create and stimulate them to become extraordinary in their approach to dentistry, in their approach to patients, and in their ability to have a long, successful career and then in the end finish well. So I speak about learning multiple facets of dentistry, becoming an expert in many areas, and we talk about decathlon dentistry, where you're not just an expert in 5 areas or 7 areas, but all 10 areas of dentistry. Dentistry is broken down pretty much into 10 different disciplines, specialist procedures, orthodontics, endodontics, prosthodontics, pediatrics, and you can get into subspecialties like laser dentistry, neuromuscular dentistry, sedation dentistry, and all these things add up to be very valuable to the patients. And when we're able to address every problem in one office, we become what's called the decathlon dentist, very comprehensive dentist. And so this is the highest order of dental practice in America. And so we're proud to support that concept and be one of the people who originated the concept, 20 years ago, 25 years ago, talking to dentists about being a decathlon dentist. One of the things that I'm most impressed with is the ability of a dentist to assimilate all this knowledge and put it to use in one facility where they can treat the patients more comprehensively than any other area. Now, what we will talk with a dentist about doing is adding multiple streams of income into their practice over the years. So what we do is we invest heavily in new equipment. When it comes out, we have a high interest in team training. So we want to educate our team members that work for us and with us. We want to have a top-notch facility, and we want to continue to seek out those state-of-the-art options to offer our patients what is most ideal and optimal for oral health. And every now and then something comes across the table that we see that's very unique and very useful. And so we got into lasers 30 years ago with the first CO2 laser, and we continue to progress and buy new lasers over a period of time. And we got the erbium YAG laser, which is water and laser mixed together, so you can work on soft tissue and bone and teeth as well, and you can do things safe and in a controlled environment. You can use the laser to cut and repair and stimulate healing. So those things are part of what we do naturally in our dental practice. But what's kind of exciting right now is the investment in systems that will allow us to reward good behavior. Let me tell you more about what I'm talking about. With the ASEA redox biochemistry, we have active agents that we can use to increase healing and reduce pain in the oral environment. And so we have our patients taking ASEA redox, and because of the financial structure of the company, we're able to create a game for the patients and the staff members and the dentist to play together to increase healing, but also to increase the financial reward for those who are involved. And that's kind of an unusual area that most dental practitioners and most patients and most staff members aren't involved in. And so we're trying to pioneer a concept with ASEA Redox where we can institute this marketing system for patients to benefit, for staff to benefit, and of course the owner of the practice, the doctor, to benefit. And so we can bring in a supplement that is something that people want to take, and because it has long-lasting benefits, as long as you take it, then there's a great incentive to continue on the product. So we want to introduce ASEA Redox to our patients for their health. We want to introduce it to them in such a way that they become lifelong users of the product, because they're going to be healthier longer. Healthy longevity is our ultimate goal, to prevent disease as well as treat disease. And we don't have any doubts that the redox system will make the body more able to treat disease its natural way. And so the stimulation of the healing of the cells through upregulation of the genes that are naturally in the body happens when we take the redox signaling molecule, right? And so we're saying to our staff, how can you be involved? How can you recommend to patients that they take this and feel good about it? And the way we do that is we offer it to them as a choice, and then we offer it to the staff as a choice to become part of the team. And we set up a bonus structure for our staff, our team members, so that the proceeds of anything that we take in from the patients goes straight to a staff bonus, where they're getting dental education and they're getting a travel bonus, for instance, so that if we're going to take a trip and do some continuing education related to dentistry, then we'll take the team together on a trip, and it'll be funded by the profits that come from bringing ASEA Redox into the practice. So it's a win-win for the patients. They get the benefit of the healing. It's a win-win for the staff because they get their education paid for. And it's a win-win for the doctor because they've got an assist in educating their staff. And it's just beneficial all the way around to have a highly trained staff. So I thought you'd like to know, how we're working, how we're bringing this into our practice, because it's important that there's a financial win for everybody involved. And, when nobody loses and everybody wins, it's a good system. It's Dr. Bill Williams in Atlanta, Georgia. If you have any questions on this concept, I'd be glad to talk with you as a dentist. Thanks so much.